This is Talk Business and Politics with Roby Brock.
And welcome to the program. I'm Roby Brock. Once again, we're glad to have you with us. The private option is set up to once again be one of the biggest battles looming in the upcoming legislative session, which starts on January 12th. The state's novel Medicaid expansion plan lost a few supporters in the last election cycle. Joining me to talk about the business and the politics of this issue is John Brummett with the Arkansas Democrat-Gazette. He's a columnist there, and he's a Talk Business and Politics contributor. Glad to have you on board and glad to have you here this morning.
Same, ditto.
All right, now you sat down with Senator David Sanders, one of the chief architects of the private option, but as you discovered, he's got a lot more on his plate than just doing something about the private option, right?
Right. What I wanted to determine is how can we possibly make the private option different in a way that would appeal to conservatives and get Asa Hutchinson on board and give it a fighting chance in the legislature. And he's got a plan.
All right.
He's got quite an extraordinary plan that's much more than the private option.
Let's dip into a little bit of your interview with Senator David Sanders.
Senator, here's what I'm trying to get at. The Governor-elect Hutchinson, there's some assumption about how he feels about this, but he's not saying. The whole debate is sort of, it's in a vacuum right now. And I'm trying to get some idea from this point person, prime architect of it, how it gets presented, how it gets couched in the coming session. And I'm hearing you say we're going to talk less about the private option and more about conservatizing health care generally.
I speak for one person and one person only. It's the guy you're sitting across from
Right.
here. I'm telling you
Right,
what I'm telling you what my goal, my aim has always been. Again, I started looking at health care in terms of public policy when I was a kid. I used to, I've told you this before, maybe even told Roby before. You know, I grew up watching Prime Minister's Questions. I knew what I don't want, or I didn't want the American healthcare market to become, and that is a single payer system. Think about what's happened just literally in the past week and a half. Vermont has been experimenting and planning a move to a single payer system. That has gone away. I don't think Americans are hardwired for that. So here I'll say this, because the idea is you want these people to move up, and then you have to ask yourself, what else can we do? Say if you're a large self-insured company that offers coverage to your workforce, what can we do to help you out to extend coverage to those employees, make it better? Think about this for a second. If you're say you're a leading manufacturer in Arkansas, you spent your time optimizing your manufacturing process, optimizing your sales force, getting the absolute best executive team that you can get, and your go-to-market strategies are among the best, and they're talking about you on all the financial services, television programs, Larry Kudlow, you name it, Roby Brock. But then you look at your HR side of the house. You're working with old, outdated models, healthcare, workers' compensation, disability, life insurance, all those things. So you're
What in the world are you talking about?
What I'm talking about doing is this. If you look at healthcare, you have to take into consideration all aspects of it. What are you doing to strengthen healthcare for all?
I understand that, but this is the Arkansas legislature, and this is the issue of Medicaid expansion, and I'm hearing you say, for your part, you're going to talk about something much broader, much more far-reaching,
well,
and really
again,
sort of subjugate the private option debate to elemental status.
No, and again, because what you're in your question, it sounds like you're saying I'm trying to sort of diminish the private option. I'm not trying to diminish the private option. What I'm saying is there's something much larger that we need to be doing.
Well, are you seriously going to talk about these larger things in the forthcoming Arkansas legislative session?
Absolutely.
Are you seriously going to offer some major package of bills?
Well, so let me say this. First of all,
to help employers with their health insurance plans and small business?
Well, there's policy occurring right now. First of all, if you look at what we're doing through our Arkansas Marketplace Exchange, we're the first state in the union that has pursued as a strategy a bifurcated exchange where you have the shop, which is a small business exchange, and then this individual marketplace, the one that's caused all the trouble. We've pushed that out. We want to focus on small business. How can you help small business offer coverage to their employees? Through a defined contribution plan, which allows a small business to write off the cost of the defined contribution, but also the individual employee the ability to write that off. Again, that is outside the rubric of sort of the Obamacare
So that's already
framework.
happening. You just need people to know and understand
it's
that.
happening, but what we have to do is to drive at that. On the self-insured market, look, we know this. In Arkansas, and Walmart gets a lot of attention. some of the most innovative things happening in healthcare today is happening in the self-insured markets. These are the big companies or even small companies that self-insure. They buy their own health insurance for their employees. The incentive, you know why that happens? The incentives are right.
Because they save money.
Well, but the incentives are right. So I think what we have to do is look.
By that incentives, you mean what?
Well, I mean, so the incentive is one, to keep happy employees that are healthy and working, but also to hold costs down. So what you've seen.
No, I thought you were getting into your centers of excellence.
Well, I mean, that's part of it. That's part of it.
Where you don't pay for everything, you pay for the best care or care
Right.
that you've chosen. That's from certain providers, correct?
That's a small sliver.
Can you get that done
of it.
legislatively?
Well, I don't think that's not the overall goal.
Okay.
Not the overall goal. The overall goal is to take the best. So go back to the private option. What did you say about it? It's this conservative policy.
No, I didn't say it was. I said that you said it was.
Okay, so it's this policy where you take conservative ideas and elements and push them in. Look at this. I'll draw you two comparisons: the state of Vermont and the state of Arkansas. What you saw in Vermont was an effort to take the private insurance markets and make it look more like Medicaid for all, single payer. It's not my words; their words. In Arkansas, what we want to do is at least on the private option side, is to take this sort of government-run program and make it look more like the private markets. Now, a key component, which I will offer legislation on this, and I think it's significant. A key component to any market, two things: the ability to make a decision on price and quality. Healthcare has largely operated outside the bounds of that sort of those traditional market elements. So I think we have to have a more open marketplace where we see, what something costs and what the quality is. What are the quality measures? What are the outcomes?
You're going to have some legislation to make a qualitative assessment of how well a doctor's doing and a hospital's doing?
What we'll do is
That's pretty big.
Have disclosure. So it's not. So
where? By whom?
Well, I think one, by providers, by doctors, by hospitals, by healthcare providers.
Of what?
Prices.
Here's the number of patients
prices,
you had,
quality,
here's
from
how
specialists.
Here's how many survived?
Sure. Well, from specialist standpoint, quality measures, the outcomes. How do they range? We have in Arkansas the episodes of care, which we are now compensating doctors on how well they manage the overall care.
We sometimes forget that reform is ongoing.
It is. It's a significant reform, but I think what we have to do is begin to help people understand their care. If we want proliferation of coverage, and we want people to behave like consumers of healthcare, then we have to have, you can have the demand side reforms all day long, which is to give people care, but you also have to have a supply side package of reforms, a good conservative term, where you're making consumers more aware.
You're not just trying to alter the conversation in regard to the private option, you're trying to explode it.
All right, that is you and Senator David Sanders. He says he wants to explode, or that's your description of what he wants to do. He wants to explode this approach to healthcare. That sounds like a pretty grand experiment. It's
as I was visiting with him, I thought this is one, pretty wonky, and I hope people can get it. But two, this is highly ambitious. His idea is that the private option is conservative because it's an element in broad healthcare marketplace reform, and it's sort of the way Paul Ryan is trying to reform Medicare at the federal level. He wants to use the opportunity to spend federal Medicaid money for expansion on the private option to enhance personal responsibility and privatize a great deal of it and reform it. And in the course of that, he's talking about disclosure of performance records by healthcare providers. He's talking about reforms for corporate insurers and self-insured in a way that could save them money. He's talked to me before. I don't think it was actually in the interview about the centers of excellence that Walmart is doing, where their employees will get insurance coverage for their surgery, but they're going to make sure they go to a place that has a good record, demonstrated record of success. He is talking about the private option, selling it to this new conservative legislature as a vital element in broad conservative marketplace reforms.
Do you think they will buy that, though? I mean, what's your sense of how big of a challenge that is going to be?
It's a massive challenge.
Yeah, and you got a huge education curve.
Right, and to many people, and on the social media after I wrote Thursday in the Democrat Gazette about this interview, expected conservative voices were saying, you know, Brummett and Sanders think this is conservative. I mean, we're spending this much money and putting this much amount of debt on our children, and sort of making a little fun of it. So yeah, it's going to be a great challenge, but I think, and well, it's fascinating, the breadth of what he proposes to do, and in the abbreviated time with a new governor. Wow, it's big.
In a real new legislature too.
Right.
If he's successful, what can you kind of craft for me a vision of what health insurance would look like in Arkansas? Would it be like car insurance nationally? Would it be, is there something to compare it to?
Well, no, I can't really, because I think he's outlined so many things. It's difficult to say, well, let's just look at the end product. It's he did stress that it's a work in progress, but health. One of what people don't understand, this conservative notion. Let me try to put it this way: to make Medicare better and introduce conservative principles to it, or maybe some work requirement, some individual responsibility, maybe some less benefits than we have now. To make it better, you have to accept this federal Medicaid money and formulate a waiver to do those things to demonstrate that they work. In the course of that, he intends, if he's still around in 2017, he'd like Arkansas to seek a full waiver, which will be permitted then, in the way we run our healthcare exchanges. What he's saying is Medicare is not working now, and we can use Medicaid is not working now, and the only way we can show anybody how these conservative principles will make it better is if we get this expansion money and continue to impose conservative principles. So it's a work in progress, but I think it's his best argument if he can get people to listen.
All right, we've got to take a commercial break here, and we've got more of this interview between Senator David Sanders and John Brummett. Governor-elect Asa Hutchinson's support would be pivotal for the reforms that Sanders is talking about. John Brummett presses him for insight after this.
As Arkansas's population grows, so do our energy demands. But with the right mix of resources, reliable, affordable power will always be a reality. These resources are all around us in our rivers, blowing through our trees, even right below our feet. The answer isn't focusing on one resource, it's embracing them all. The electric cooperatives of Arkansas know that a balanced approach to power builds our communities and powers our dreams. Visit themixmatters.com and see why there's power in knowledge.
And welcome back to the program. I'm Roby Brock. I'm joined this morning by John Brummett, Democrat Gazette columnist and Talk Business and Politics contributor. You sat down earlier in the week with Senator David Sanders, one of the chief architects of the private option and some other health care reforms. He's got an ambitious agenda. In this next segment, you're looking for more insight as to what Governor-elect Asa Hutchinson may think about this. Did you learn what his insight might be?
No, and it was not for a lack of trying. But I do know, and have known for some time, that these principles, these conservative notions that David Sanders talks about, he's been in discussion, he says to a lesser extent, with Governor-elect Hutchinson. He was in discussion with him during the campaign. Sanders is very close to the new governor's chief of staff, Michael Lamoureux, to the budget director, Duncan Baird, who understands the need for the private option, to a couple of other people who are longtime friends of Sanders, who understand some of these concepts and agree with them. So I thought we might be able to use Sanders to get at what the ever-evasive, ever-elusive Governor-elect Hutchinson is going to do. And I think I have an idea, but we didn't get any concrete.
Let's just take a look at how hard you tried to get that insight.
All right. I know you don't want to and will not speak for the Governor-elect, Asa Hutchinson, but there is no way in the world you haven't shared these kinds of views about what we need to do. There's no way you haven't shared those with him. You've had made these kinds of this kind of analysis in an advocacy way to the new governor-elect, have you not?
Probably not in this manner that we just had here in terms of sort of plotting it. I've had conversations with the governor-elect about sort of the overall goal. Overall goals and what we should be driving at.
As you've, maybe not as you've said here, but similar in terms of this, the private option is but an element in market reforms that we need to be pursuing.
Yes.
Now I know you're not going to speak for him.
No, I'm not.
But what did he say? Can you in any way assess his reaction? Can you give some general? What does he just look at you, or does he go or what does he do?
People just look at me all the time.
Right.
My wife, my children. No. So
No, he doesn't just look at you.
No, I want to catch it in these terms. I think two things. One, we've been part of Republican gubernatorial transitions before. I worked
meaning you with Governor Huckabee.
Governor Huckabee, but I found a front page story that you wrote over the weekend back in '97 where you came in and watched. So
you mean you and I have been, sure.
Yes. We've experienced this before.
Well, of course.
Different roles, of course. I was a sort of a menial intern.
What that has to do with my question, I don't know.
My point is this: there's only so much bandwidth that you can have when you're sort of a governor in transition and trying to put a government together.
You mean
John,
he needs to narrow
I would
his
be dishonest if I sat here and said, yes, I've had detailed conversations with the governor about these very things and laid out the whole plan. That would be dishonest. I have had conversations with him about these things. But
can you give us a hint as to where he's headed with this issue? Because we know where you're headed. You're going to advocate market reforms and continued reform of the health insurance and healthcare delivery system, of which you consider the private option a mere element which needs to be continued. Is Governor-elect Hutchinson, are you confident that he is going to be an ally in those efforts?
I mean, the optimism that I spoke of at the beginning of the interview, I have. I think that carries through. I think you have to look at Asa Hutchinson as an individual, as an elected official, and how he has functioned. He's always been a reformer. You look when he went to Congress,
from the campaign finance reform,
and was out on the leading edge, sort of almost taking sort of counterintuitive approaches, at least politically, rather than just sort of staking out solid ground of what others, outside folks, would consider sort of the conservative path.
All right, you gave it your best effort. I'm going to give you an A+ for effort there. So what is your sense of Governor Hutchinson's approach to health care reform, to the private option? Do you think he's going to be one of these governors that takes the art of the possible in terms of politics, or puts policy over politics?
Goodness, I can't possibly say. I think Sanders says that he knows Governor-elect Hutchinson to be thoughtful and sometimes counterintuitive. I think that's probably true. And I know that Governor-elect Hutchinson understands the budget savings from the private option, and I know he understands the need to repackage the private option in a way that makes it appear more conservative and makes it actually be more conservative. So I think some element, some less ambitious element of what the wonkish Senator Sanders has outlined is where the governor-elect may be headed.
All right, we got about 60 seconds here. So you've got a new Surgeon General, Dr. Greg Bledsoe. You've got a new insurance commissioner, Alan Kerr. Right. Those have been two positions in the Beebe administration that have been big advocates for a lot of these changes. Representative Kerr has voted against the private option on occasion. Do we have signals from the Hutchinson administration that either...
Not from those appointments. I know nothing about the new Surgeon General. I don't think anyone does, except his name is Bledsoe, and Cecile Bledsoe is definitely against it. But I don't know that necessarily follows. No, those appointments tell us nothing. I think the most interesting thing we know about Hutchinson is that someone went up to him on the street the day after he was elected governor and said, "We must save the private option," and he said, "It's challenging," and she said, "But you're the only one who can do it," and he said, "Thank you." So I think that's about all we got from him at this point.
All right, we got to end it there. But you can catch out that full interview. It's about 30 minutes long with John Brummett from the Democrat Gazette, Talk Business and Politics contributor, on our website at talkbusiness.net. You also got a news story coming out in our next magazine, too, next issue of the magazine, on this new legislature versus the old legislature.
I do.
Yeah, appreciate you being here.
I'd forgotten that.
We'll have you back for a cameo.
Okay, thanks.
After the break, the tradition of the Gillette Coon Supper lives on. You just thought it was going to be a dull political year. Farthest thing from the truth. A preview of this iconic political tradition when we come back.